Hello, I'm Wendy from Dr. Harvey Levy and Associates office. In our first video of the series, Stages of Tooth Decay, we gave an overview of 4 main stages of tooth decay. In our previous videos, we covered them in detail: demineralization, enamel decay, and dentin decay. Today, we're going to focus on the final stage, the truly painful stage of tooth decay, pulp damage and abscess. Let's review. Bacteria and plaque penetrate the enamel and goes deeper into the tooth, leaving a hole behind. In our last video, the bacteria was already deep inside the tooth, at the dentin, almost reaching the nerve center of the tooth. That nerve center is called the pulp. Tooth pulp is soft and consists of living blood vessels, connective tissue, and sensitive nerves. Ouch! That's what happens when bacteria goes deep inside the tooth, reaching the nerve. A tooth that has a deep cavity becomes very painful. Sometimes the toothache is sharp, but it can also be dull. Many people experience throbbing pain when biting down and become sensitive to extreme temperatures. The innermost area of our teeth hurts because it contains nerves surrounded by blood vessels. The bacteria, ever hungry, start damaging the pulp and the nerves. The body defends itself by calling in an army of white blood cells, causing inflammation. This is called an infected pulp or pulpitis. Symptoms of pulpitis can include fever, a bad taste in your mouth, and possibly together with pain. The inflammation can get even worse. As the infection spreads within the tooth, a little pimple on the gum called a fistula may form. That pimple can grow into an abscess, which is basically a big pocket of pus. Pus is that army of white blood cells we talked about earlier, who are trying to fight the infection. As the abscess grows, it's possible to see swelling around the gums and face. Tooth infections can be sneaky. Sometimes they go undetected because you feel no pain. The bacteria can reach your eyes, your heart, and your brain through your bloodstream, a condition called bacteremia. Organ damage can result. The final stage is called septic shock, a life-threatening medical emergency. Summing it up, an untreated tooth infection can actually kill you. If you suspect that you have an infected tooth, it is crucial that you go to the dentist. They will prescribe medications called antibiotics, which kill the bacteria. It is important to take the entire series that you've been prescribed. The antibiotics are fighting the infection even if the symptoms appear to have gone away. Please don't take any pills you find lying inside the house, which may be expired and may not be the right kind of pills to fight the infection. Unfortunately, in severe cases, infection moves beyond the tooth to surrounding bone, leaving the tooth feeling loose. Your dentist may recommend having the tooth removed rather than trying to save it. If you choose to pull the tooth, expensive decisions may await you. Do you replace it with a removable partial denture, a bridge, or an implant? Restoring the tooth requires the dreaded root canal. This is when your dentist or a specialist called an endodontist removes the infected nerve inside your tooth, relieving the pain. If you experience tooth sensitivity or swelling in or around your mouth, make an immediate appointment with your dentist. We consider a tooth infection to be a dental emergency and will do our best to see you even if you do not have an appointment. To prevent dental emergencies, visit your dentist and don't ignore cavities in the earlier stages of decay. A broken tooth is a doorway for bacteria to enter. An injury to a tooth may cause pulp damage even when there's no visible cracks or chips. Remember to reduce your chances of getting cavities. Cut back on sugary and acidic foods and drinks. Brush and floss twice daily to remove the plaque, and see your hygienist and your dentist for regular checkups. If you skip the dentist, you may develop cavities between your teeth that you'll only be able to feel when the decay has already reached the dentin, or worse, the pulp.